Hi, I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, to discuss treatment for communication disorders. When we talk about communication disorders, we're talking about the inability to understand or to use speech and language. And the four areas of communication disorders, and this is, of course, certainly to relate to others. So when we're talking about communication disorders, we can put them in four primary categories. Talking about language, articulation, voice, and stuttering. And if we're talking about language, we're talking about the ability to speak, to listen, to read, and to speech, the ability to speak, the ability to listen, the ability to read, and the ability to pronounce. So we're talking about the language as far as communication disorder. That's those four areas. Stuttering is obviously the ability to have a regular flow of talking. Articulation is how we pronounce and speak. And an area of voice is really dealing more with the vocal cords to actually produce speech. Now, what's the treatments for communication disorders? Well, certainly anybody in kind of speech pathologist can begin to work with those types of disorders. Sometimes the communication disorders are driven by some psychiatric condition or mental and nervous disorders such as depression or anxiety or trauma. So certainly it may be necessary to, in fact, seek out psychiatric help or the help of a therapist to assist you with the communication disorders as well. But oftentimes communication disorders show themselves in your youth, and school officials have professionals on staff that can work specifically in those areas. They tend to be in the area of speech pathology. Now there's other kinds of communication disorders, but those are the major four. And the treatment is generally psychotherapists, psychiatrists, and other professionals specifically in that area. Well, I hope this information has been helpful to you. From Tampa, Florida, I'm Dr. David Thomas.